to talk about HIV health concerns is Dr. Jason Halperin, an infectious disease expert. We have so much to talk about. The nation's talking about this today. Charlie Sheen denies infecting any of his partners. Can you give us insight into how this virus works in that regard?
Sure. So when someone is infected with HIV, then they are started on medication. That medication leads HIV to not be found in their blood. It's called viral suppression. And when someone is completely virally suppressed, meaning I can't find it in their blood as their physician, then they're very unlikely to transmit the virus. So that is why Mr. Sheen is saying this.
Okay, so just for clarity.
Please.
The question, is it transferable? Sure it is, but not likely if you're on the drug.
So that's correct.
Okay.
So transmitting HIV is very difficult when you are on the medication.
Okay, gotcha. Sheen says that he's on a triple cocktail of HIV medications, takes 4 pills a day. What does that entail?
So what that includes is you need to be on combination therapy for HIV, which means that there's different parts of the virus that you're targeting with the different medications. So the 4 pills work at different parts of the HIV to ensure that you keep it under control.
And will he take this now for the rest of his life?
So as of now, there's no cure, but by staying on the medications, you are keeping the virus completely under control. And he will need to do that for the rest of his life, for now, until we find a cure.
Okay. And public experts still advise very strongly that people with HIV use condoms with sexual activity, right? Another way to protect sex partners is for them to take the HIV drugs, as we've mentioned. A study published Monday says that when people take drugs, they're far less likely to catch that virus from infected sex partners. Is your advice also to involve condoms in sexual activity?
So you're exactly right. It's a great question. Always use condoms. That is the safest way to protect yourself. But there is no question that when you're on medication and you're virally suppressed, then the chance of you transmitting the infection is extremely unlikely. So for society, we got to get people tested and on therapy. And for people who do not have HIV yet, they can use condoms, and they could also take a medication which is called pre-exposure prophylaxis.
And you say there's a way to prevent HIV.
So correct, there is a medication that is highly effective. It's 1 pill once a day for people who are highly at risk for HIV. They can take that medication and that will prevent them from getting infected.
All right, well, thank you for breaking down some of those issues for us there. We want to show a phone number in case people have questions on where to go and where to call in case they have questions. It's right there on the bottom of your screen. If you have any questions, you can call there and get information from the helpline. Thank you, Dr. Halperin.
Thank you so much.
Thank you.
I appreciate it.
All right.